Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, living with uterine fibroids. If you have been diagnosed with uterine fibroids or suspect you may have uterine fibroids, you can take control of your health. While every fibroid journey is unique, suffering in silence and enduring pain is unfortunately all too common. /r/n/r/n This article discusses the emotional, physical, social, and practical effects of uterine fibroids, along with insights into the impact on Black women. /r/n/r/n Very well, Teresa Chicky /r/n/r/n If you have fibroids, it's likely that your pain isn't just physical, it's emotional, too. /r/n/r/n A small study conducted by the Northwestern University Feinberg School of Medicine on the emotional impact of fibroids found that women report having a significant emotional response to their fibroids, ranging from general worry and concern to fear, anxiety, sadness, and depression. /r/n/r/n Half of the women said they possessed a negative self-image, underscoring the stigma that comes with the diagnosis, and many of them expressed that their insecurities made intimacy with a partner difficult. /r/n/r/n Black women can experience complex feelings while navigating uterine fibroids, including feeling :r/n/r/n The good news is that women who choose to treat rather than endure their fibroids often have an improved emotional, physical, and mental outlook on life. /r/n/r/n The emotional toll of uterine fibroids is simply not talked about enough, which perpetuates the idea that women should simply tough it out. They should not. /r/n/r/n Fortunately, small modifications in your lifestyle can result in huge benefits when managing uterine fibroids. /r/n/r/n Start with changes that are easiest for you to make. Some of these changes include /r/n/r/n Emotional support is just as important as medical treatment for many women dealing with fibroids. Many women find that joining a support group helps them not only come to grips with their diagnosis, but also helps them pinpoint the resources and community they need to live a happy and healthy life. /r/n/r/n You may also find it helpful to work with a professional listener, such as a social worker, a psychologist, a psychiatrist, or another mental health professional. Some women prefer this in lieu of support groups, while others enjoy coupling the two. /r/n/r/n Below are some resources that may be helpful to women who are struggling with fibroids: /r/n/r/n Coping with fibroids is a long-term journey. There is rarely a quick fix. Still, living a happy and healthy life is possible. /r/n/r/n Starting a medication regimen or contemplating surgery can be daunting, and concerns about medication side effects and infertility often linger, but the stress of fibroids does not end there. /r/n/r/n For people without health insurance, treatment with drugs can be anywhere from $20 a month to $240 per year more for name brand drugs. Treatment with surgery can cost between $10,000 and $20,000. /r/n/r/n Additional costs for imaging, such as pelvic ultrasounds and MRIs, and lab tests can also drive up costs. /r/n/r/n Fortunately, there are services out there that can help mitigate costs. The Department of Health and Human Services offers a locator for clinics that provide discounts on an income-based sliding scale. /r/n/r/n Hysterectomy rates among Black women are more than double those of any other ethnic group. This statistic is rooted in the fact that some Black women are only offered this option. /r/n/r/n That said, research also shows that Black women are likely to have both larger and a greater number of fibroids than their white counterparts. Due to this higher burden of fibroids, they are more likely to undergo more invasive procedures. /r/n/r/n Black women should not have to give up future motherhood before they are ready to do so. If you have experienced this, it is important to know that you are entitled to seek a second or third opinion. /r/n/r/n One of the main symptoms of uterine fibroids is abnormal or heavy menstrual bleeding. Fatigue is one of the earliest and most often missed symptoms of uterine fibroids, as severe blood loss may lead to anemia and iron deficiency from the lack of red blood cells. /r/n/r/n Large fibroids may also limit your mobility, cause depression, and interrupt your sleep patterns, further making you even more tired. /r/n/r/n Eating a low estrogen diet can help shrink fibroids naturally and boost your energy. This includes /r/n/r/n Uterine fibroids do not have to rob you of the best years of your life. Finding help may not always be easy, but there are a growing number of resources that can get you started. /r/n/r/n An individualized treatment plan is likely the best way to manage your fibroid symptoms. /r/n/r/n An honest discussion with your healthcare provider about which symptoms you find most bothersome and how they affect your quality of life and your desire to have children in the future can help streamline the treatment process. /r/n/r/n While a single doctor's appointment may not provide you with all the answers you are looking for, you may be surprised at how quickly your symptoms improve once you get the help you need. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.